Dear audience, what I would like to present you today is my PhD topic, Investigations of Halitosis. My name is Eszter Szalai. I am a clinical specialist at the Department of Conservative Dentistry, and my vision is to find and bring the best solution for diagnostic and managing halitosis to everyone. To reach my vision, my mission is to contribute to oral health and well-being by providing the best care to every patient. These are my first steps, how I would like to achieve my vision. My first two projects are systematic reviews. The third one, a validation study about the Cyranose device, which one an eNose. And the fourth, a planned randomized control trial. So the new title of my first project, Daily Use of Chlorine Dioxide Effectively Treats Halitosis, a meta-analysis of randomized control trials. We already submitted our manuscript in the Journal of Evidence-Based Dental Practice, and we hope we will soon catch an answer. So I would like to highlight the importance of this topic with this quote. A bad mood is like bad breath. Both are wrong to inflict onto others. 60% of the world population has experienced halitosis, and 90% of all cases originated from the oral cavity. It means we spend billions of dollars a year on anti-malodor mouth rinses, but we still don't know which is the best. Chlorhexidine mouth rinses considered as the gold standard mouth rinses, but they have several side effects. The unmet need is an effective mouthwash in halitosis without serious side effects. Our aim is to evidence the effectiveness of chlorine dioxide in halitosis. Consequently, our clinical question, how do chlorine dioxide containing mouthwashes influence the level of halitosis? We would like to compare chlorine dioxide with other mouthwashes and placebo. Our hypothesis that chlorine dioxide mouthwash is as efficient as other mouthwashes or more efficient than placebo. After our systematic search, we made the full text selection, and we found 10 eligible articles, and we could include in our meta-analysis 7. On the first 3 forest plots, we will see the changes of the organoleptic measurement. Organoleptic measurement is the gold standard measurement of measuring halitosis. It means that the tester evaluates the patient's breath from 0 to 5, 0 when it's no malodor, and 5 when it's very severe. The 1 day and the 1 week data visible in the first slide, and the second slide we will see the 2 week data. It's also visible that the heterogeneity at the first 2 cases not really important, and we receive significant results. And also we can say that chlorine dioxide mouthwashes reduce the level of halitosis with almost 1 level. On the 2 week data, the heterogeneity is substantial, and we think the main reason Volatile because of the different rinsing protocol, and we also just received the tendency, and we think it's also another reason that the researchers didn't allow to the patient that rinse with the chlorine dioxide on the measurements morning. Let's move on the objective measurement of the halitosis, which is the volatile sulfur compounds measuring. The main volatile sulfur compounds is the hydrogen sulfide and the methyl mercaptan. The heterogeneity is really high, and we think not just Volatile, but it can cause growth Volatile because of the different, because the longer compository mouth closing before the measurement. And also bacterial differences can caused by racial differences, which is present here because growth Volatile from UK and the other 2 authors from Asia. Also visible that chlorine dioxide is more effective on hydrogen sulfide data. So the strengths of our meta-analysis that no former meta-analysis from this topic, all of the included studies are randomized control trials, and we could perform a meta-analysis from the organoleptic testing source in more time points, and also from separated volatile sulfur compounds data. Or limitations, the small number of studies, and also that we couldn't perform a meta-analysis with other mouthwashes, for example, chlorhexidine, because we just found 1 eligible article that was with chlorhexidine, and it was Shetty et al. What is the implications for research? We think that with elevated hydrogen sulfide level, patients can receive targeted therapy. What is the implications for research? We think that it will facilitate more investigations between chlorine dioxide and chlorhexidine mouthwashes, and we also plan a randomized control trial with this comparison. And also, we would like to suggest that further studies should present their data also in total volatile sulfur compounds with standard deviation when it's made by oral chroma, because in this case, the results will be more comparable. What kind of conclusion can be drawn for this? That chlorine dioxide mouthwashes have to receive a more prominent or leading role in the therapy of oral halitosis based on our results and the lack of known side effects. So let's move on my second topic, which is the volatile sulfur compounds measuring devices in halitosis. As I mentioned, the organoleptic measurement is the gold standard measurement. It's subjective, unreliable, and as we can see on the picture, it's uncomfortable for the tester and the testee. Other methods, the oral malodor measuring devices, they are objective, the results repeatable and reproducible. The most used device is the portable volatile sulfur compounds monitor and the portable gas chromatograph, the oral chroma. We have several other devices, but this is the most used. The unmet need is clear guidance in the objective measurement of halitosis. So our aim is to standardize protocols for clinical research into oral malodor. It brings us our next clinical question: which of the volatile sulfur compounds measurement is the most suitable for measuring halitosis? We would like to involve adult population without systematic diseases, and our reference standard will be the organoleptic measurement, and our index test will be the objective malodor measuring devices. Our primary outcome will be the correlation coefficient, and the secondary, the sensitivity and the specificity. Our hypothesis, the halitosis measuring device is as appropriate as the organoleptic method to measure the level of halitosis. We truly believe, after our results, we can suggest a clear guidance in the objective measurement of halitosis, and in this case, we will gain shorter and more effective studies with comparable results. After our systematic search, we made a full text selection, and we found 74 eligible articles. So we also made the data accession and the risk of bias assessment with the QuADAS-2 and QuADAS-C tool. And I plan to finish my second project in August, and I hope after that have more time on my other projects. Thank you for your attention. The first and greatest victory is to conquer yourself.
In the second topic, in your PICO, you have showed us the population, both the patients were adult population without systemic disease. And how about the intraoral diseases? So since halitosis is caused by intraoral changes and diseases like periodontal disease, any other bacterial destruction of saliva and epithelial cells, so isn't it a bias?
No. Yes, no, because these devices mostly measure the oral malodor. So we want to contain oral malodor. We just want to exclude the systematic diseases because we have a subgroup, and we will measure also this. But the first data show us that it's not really as good as in the oral malodor.
Because
effect of devices.
As a general dental practitioner, so treating the oral diseases used to be very effective in case of halitosis. So it could be a subgroup where there are no systematic disease either, intraoral diseases, and the patients even have halitosis because of their tongue flora or something like that.
We will consider it.
Thank you.
Well, this was very interesting, and I have never heard this word halitosis, but I know the word bad breath. And how can you differentiate between bad breath that originates from the blood? Because, for example, if you eat onion and garlic, that comes from the lungs, from the blood. So how can you differentiate between oral origin of malodor or blood originated or other sources?
It's not really solved this problem, but I have read a few newer articles, and they suggest that there is a cysteine induction. That means that the bacteria that is present in the oral cavity use this cysteine, and it's elevated the level of hydrogen sulfide and methyl mercaptan. And in this case, it means it's from the oral cavity, if the cysteine induction is working.
I just would like to support these words. As a dentist, you definitely can distinguish the smell of garlic and the smell of cadaverine. That's kind of different.
First of all, I mean, this is very good to see, I mean, how this project develops. I mean, that you started with the meta-analysis and now multiple projects, and at the end, actually, there are clinical trials. So, I mean, that applies not only to this study, I mean, this person, I would say that, but also to many others. So I just encourage you to go to this direction, those who didn't open to that, because what you really learn from the meta-analysis, I mean, you can really utilize, you and your bosses, I would say, the tutors and so, I mean, in real good clinical trials, and you have the capability for this. So I think this is great. In your, I just wonder, in your clinical study, when you compare these different kind of measurements, so how do you adult population without systemic diseases? So how do you select them? Because probably there is going to be a wide range, and that is good to have extremes. So what's the plan for the design, selection of patients?
Mm-hmm. We check the range of the age, and if it's not in the article, I contacted with the author, and I would like to include just that kind of studies that include just adult population, and we have another subgroup with the children also.
Yeah, but I mean, for example, looking at those who eat garlic every day, I mean, maybe the pattern will be different to those who eat, I don't know, spinach or what proper. Yeah.
Yes, before the measurement, they usually didn't allow to the patient to eat this kind of foods or drinks, and also didn't allow to use mouthwashes and so on.